Today's video is going to be how to take good decisions and grow. Life is all about decisions, whether it is small decisions like do I wear a blue or a white shirt today? Will I have vanilla ice cream or chocolate ice cream? Or it could be bigger decisions like do I take up this job or not? Shall I buy this house or not? And when it comes to the medical profession, it becomes even more valid since it may even involve life and death. Shall I give this drug or shall I give the other drug? Should I do surgery for this condition or shall we wait and see? If we wait, what is it that we may lose? If I need to do surgery, what surgery should I do? Option A is risky but gets more benefits. Option B is safe but has some disadvantages. When we give a particular case to a group of doctors individually, asking them to plan the treatment, we will see some patterns. Let us consider a hypothetical problem. An injury on the hand while playing volleyball, presenting now with a deformed finger. It is actually a fracture of a bone in the finger. It must be treated correctly and effectively to get back good function in the finger and complete hand. But if it is not treated properly, it will lead to complications and loss of function and sometimes pain. There are options in treating the problem. It could be managed with a splint. The broken bone could also be fixed without using surgery. It can be operated. And in surgery, there are different techniques. How to take this decision? Now we present this problem to 4 hypothetical doctors. Let us see what decisions they take. Our hypothetical doctor 1. He has never seen this condition before, but he thinks there is nothing to it. He just prescribes painkillers and sends the patient away, saying that the treatment is complete. Doctor number 2 knows that there is a problem, but he does not know how it needs to be managed. He seeks the advice from a senior and then sends the patient to a specialist. Doctor number 3 is a specialist. He has learnt about this problem, but he does not want to take the bother of treating it. So he decides to just apply a splint and send the patient off. Doctor number 4 is a specialist. He examines thoroughly, he plans a management, discusses with the patient and relatives, and then takes the decision for management after considering all the options available. Let us analyze the decisions taken by these 4 hypothetical doctors. The first doctor did not know, and he was also not aware that he did not know. The second doctor also did not know, but he was aware that he did not know. The third doctor did know, but he was not aware that he knew and that he could apply his knowledge. The fourth doctor knew and he was also aware that he knew. That gave him the confidence. There is an old saying that goes like this: he that knows not and knows not that he knows not is unaware. Educate him. He that knows not and knows that he knows not is a pupil. Teach him. He that knows and knows not that he knows is asleep. Awaken him. He that knows and knows that he knows is a teacher. Follow him. Obviously, we can understand that the right decision has been taken by doctors 2 and 4 who ensured that the patient got a good treatment. How is it that these doctors took correct decisions? That is because they know themselves and what they are capable of doing. So, is it knowledge that is important to take a good decision? No, because there are many knowledgeable people who take a very long time to come to a decision. So what is it that helps us to take good, correct decisions in time to solve a problem? That is what we are going to see in this video. Before understanding how a good decision must be made, we must understand who are the people who are involved. That is, who are the stakeholders. The most important person here in this decision-making process is the patient. He is the one who is going to receive the treatment. And the second important stakeholder is the doctor, who is going to take a decision regarding the management. Let us first consider the patient factors that must play a role in the decision making regarding the treatment. The age and gender must first be considered. There are some treatment options that cannot be given very young age or very elderly age group. Similarly, the gender details also must be considered. The decision maker must consider the socioeconomic background also before making a decision. For instance, the patient may be a migrant laborer who has sustained an injury to the hand. He may not receive the support from the factory where the injury occurred, and he may not have caregivers to support him throughout the treatment. A decision of a procedure for such a patient should get him back to work as early as possible and not involve major surgical exercises. The intelligence level of the patient is also important. You cannot take a decision to do a complicated procedure which the patient may not be able to understand, especially when it involves an injury of the hand. It will entail physiotherapy later and understanding by the patient. If the patient is not able to understand that, it is better not to do those procedures and do other procedures that will give back a basic level of function. The psyche of the patient is also important. For example, there may be some patients who are very restless from the very beginning. It is not just because of the injury or the problem, but they are basically very impatient. It is better not to decide on a complicated procedure for such patients in which complications may occur. The patient may not be in a mindset to accept the complication. Having talked about the patient, now we need to talk about the person who is actually going to take a major part of the decision, the doctor. He should be aware of the entire problem. He should be aware of the patient and all his details. He must be aware of all the options available for treating the problem that the patient has, and he must also decide on which option would suit this particular patient in this particular situation for this particular problem. And this decision must also take into account the available resources. For instance, the doctor cannot make a decision of doing a microvascular surgical procedure for a patient when a microscope itself is not available at that particular situation. Considering all these, the doctor must now make a great decision regarding the management. To help us decide what makes a great decision, let us see the important points that go to make a great decision. First of all, the decision must address the root cause and not just the symptoms. If a patient has a fever, a decision can be made to give a tablet to reduce the fever, but then the root cause must be found out and that cause treated. So the root cause should form an important factor in the decision making. The second point is, when making decisions, we need to consider the holistic impacts of a problem and involve the other important stakeholder, who is the patient. So we need to balance the risks and potential impacts of each decision that we make. For example, one option may involve a long period of hospitalization and monitoring of the patient, but it can give excellent results. Is the patient good with that? Another option may give average results but can get the patient back to work quickly. Would the patient prefer that? So the patient must be involved in all the decisions that the doctor may take. It is not only consideration of the holistic problem, but the doctor must also consider short-term and long-term value when making a decision. Short-term results are good indicators of success, but long-term results are enlightening. For instance, if there is a big wound caused by an injury, the short-term goal may be to heal the wound, but this may not result in function, as the underlying structures like muscles and nerves may be injured. So the decision must be to carry out a procedure that will ensure not only healing of the wound but also return of function. And remember, the decisions should be timely. Speeding up the decision making process starts with understanding the core elements of a good decision. If we consider all of the options listed, then it's simply a matter of addressing each one with a heightened sense of urgency. So we need to go through all the options quickly after understanding each of them. So we are of course going to consider the different options available for taking a decision for a particular patient. But in doing so, there are certain important guidelines. In the book, The Computer Science of Human Decisions by Brian Christian, there is a concept that says that if you are evaluating a set of options, you should explore about 37% of them before making a decision. That is, you consider 37% of the most important options available. And after this exploration phase, you should choose the next option that is better than any that you have previously seen. This they call the 37% rule. In this book, they also talk about the concept of optimal stopping, which suggests that in decision making there is a balance between exploring options and committing to a choice. You cannot go on exploring options without committing. You need to stop somewhere and take a decision. This principle can be applied to various life decisions like choosing a job or a partner. So, we must know when to stop and apply the brake to make a decision. And while considering each option, we must also take into account the trade-offs when making decisions, whether it is time, money, or effort, and recognizing the limits of resources can lead to more effective decision-making strategies. So, we need to consider the pros and cons of each option. I can quote the example of a loss of thumb for a patient. We need to consider all the options available before making a decision of a particular procedure that will give back the thumb to this patient and also make it functional. It is not only different options that we must explore, but we must also explore different viewpoints. There may be other doctors also involved in the decision making process, and there may be the caretakers of the patient also expressing their views. When considering the other doctors involved in the process, consensus seeking should never be our goal because it will not give us the freedom to act based on our knowledge. For example, if there are 5 doctors with us, 3 say option A is good and 2 say option B is good, it does not necessarily mean that you should go with option A. You should decide based on your assessment of all the options available as we have already seen. Similarly, the viewpoints of the patients and the attenders also should be considered in planning the management. After all this, you would have made a decision. Once you make a decision, you should be accountable and claim responsibility for the decision, whether it turns out well or not. If somebody suggests some tablet and you take the decision of giving that tablet, you should claim the responsibility for your decision. If there is a problem that occurs, you should not say that it was only the other person who suggested it. It is only weak leaders who find it comforting to have their decisions endorsed by the people around them. So they don't want to feel exposed by making a decisive call that might prove unpopular regardless of how necessary it might be. But when accountability is shared, it dilutes your decision and your effectiveness as the person who has made the decision. Yes, it is scary when you're finding you're just starting as a practitioner and you're just starting to build your confidence. But it must be done to get you stronger and more decisive. Once the decision has been taken, it should be communicated well to the stakeholders. That is because you want everyone aligned on the outcome. That is why communicating the substance and reasoning behind your decisions to the stakeholders is so important. The purpose of this communication is to bring everyone up to a consistent level of understanding, which is often necessary for the smooth implementation of the decision. That is, the treatment protocol. As medical professionals, we take multiple decisions every day, and each within a limited time. Learning to make good decisions without hesitation or procrastination is a capability that can set us apart from our peers in clinical practice. Whether the decision we have taken is good, bad, or indifferent can be assessed only by assessing the outcomes of the decision. We may make bad decisions, but reflecting on those bad decisions will help us make good decisions later. So, when you have a commitment to prospectively evaluate your decisions, you will find yourself able to make better, faster decisions than you have ever done before. And learning this as a young doctor will accelerate your development and lift the performance of yourself and your team.